When your teenagers go out tonight, it's just about certain they'll be offered drugs. Some will take them. At a Melbourne rave party last weekend, a 25-year-old man collapsed and died. The autopsy likely to reveal traces of the dance drug GHB in his system. A drug now so widespread, one of the country's top neurosurgeons volunteers each weekend to join the frontline medical teams trying to keep youngsters alive.
The local anaesthetic in, okay?
We had one patient who was brought in handcuffed by the police.
Are they violent?
Yeah, they can be aggressive towards the staff, they're unappreciative.
Massively more dangerous, massively.
Your teenagers could be in this crowd, but when the rhythm's not enough,
They're totally confused, they're spaced out.
they dig deep into dangerous zones, paying for this drug, GHB, better known by its street name, GBH, grievous bodily harm. In the 60s it was used as a general anaesthetic, a hypnotic in the treatment of insomnia and depression. Now it's made its way onto the party scene with sometimes deadly results.
I was actually shocked because I hadn't experienced it before, and when I went to the concerts more recently, I was just absolutely shocked at the young people that were getting totally bombed out and stoned and messed up mentally with these drugs.
When teenagers tempt fate, and if you're lucky, this man will watch over them.
We resuscitate them, we give them intravenous fluids because they've often been vomiting, they're dehydrated, they've got a very fast pulse, and we have to wait for their pulse to slow down.
Professor Dr Rosenfeld's lost count of the number of lives he's saved as a neurosurgeon. Each day at the Alfred Hospital, he sees people battling the odds. Then, instead of taking a day off, he volunteers as a St John ambulance officer every weekend, saving kids gambling with GHB and their lives.
Just how long ago?
About 10 minutes ago.
10 minutes ago. Was anyone with him?
If they come in acutely ill, then I'm going to treat them as much as I have to get them well. Whatever they've done to themselves, whatever's happened to them.
5, 3.
3 would be best.
He doesn't judge, but he does worry. Is it disturbing for you to see them in this state?
I'm very upsetting because these are young people that are, some of them are university students, some of them are, they're holding down a normal job, and they're totally out of control.
And he's not alone. Sydney and Brisbane mirror Melbourne's problem. And another professor, Gordian Fuldy at St Vincent's, has seen the curious looking for party kicks die.
We've actually had deaths, 2 deaths in the last few months. We've had a lot more patients go up to intensive care because when your reflexes get depressed, you end up aspirating your stomach contents. You breathe them in, and that means you're in intensive care and you've got a good chance of dying.
When partygoers become patients, they need intensive care, the same beds needed by heart attack patients and acutely ill. It pushes emergency departments to the limits.
We've got to walk away from other patients and help these people. It's usually through the wee small hours of the morning when you're on your least staffing. No, they consume resources, and we wish we didn't have to do it.
Even the emergency team at this country Victorian hospital is scarred by its violent brush with the drug. So how many patients did you have, GHB patients, in ICU that night?
We sent 3 to ICU that night, over the night, and the average stay for them was sort of 4 to 6 hours. And
when they come out of it, what are they like, Andrew?
Well, they're disoriented, they're unaware of how they've got there, they're probably unaware of how long they've been there because of medications that have been used to keep them asleep.
Dr Andrew Crellin headed up Ballarat Base Hospital's emergency department the night several partygoers at nearby Cryle Castle experimented with the drug. Hours later, the users were now victims and swamped the hospital.
Well, I'm appalled that it compromises our ability to care for the patients that we have in the organisation. And the night of the last rave, patients of ours had to wait for 4 hours for treatment, and that's not good enough.
The intensive care staff suffered when the 3 intubated patients woke up with aggressive behaviour.
And there are now legal arguments over the organisers of the dance party holding another one at the same venue. Andrew Rowe, the hospital CEO, fears it could happen again.
We believe the only way to resolve this problem is actually to have the rave cancelled. When many of the drug overdose cases wake up, they then abuse the staff, they threaten staff, we've had staff assaulted, and we've had staff that were spat on.
It's no trouble for Australia's teenagers to now buy a few mils of the death drug, $30 a time. Many will never experience the joy of getting old.
GHB is incredibly dangerous because what we're seeing now, it kills.
I think if their parents knew that they were doing that and looked like that, their parents would be absolutely beside themselves. And their brothers and sisters, I mean, and even if they could see themselves on a video after the event, I guarantee you they'd never take the stuff again.
You certainly wouldn't touch the stuff. Claire Brady reporting.